going to be on Neisseria gonorrhea. We have a panel of four. Of course, it's me, Carlene,
Meseret,
And Rosalie, Cheryl.
So Cheryl, exactly what is gonorrhea? When was it discovered?
Okay, it was discovered by Nestor in 1879, and the garden calling the meaning flower of seed because condition was associated with the urethral discussed in men. This is Genesis lacerate. It is gram-negative cocci. It is aerobic and grows in mesophile temperature glass. Hi, Rosie, do you know how it can be transmitted?
you know what? This gonorrhea can be transferred through sexual intercourse, vaginal, oral, and anal. And the mother can also transfer this disease during delivery to their child and can cause eye infection and worse blindness to their child.
Oh my goodness, that's a lot.
An innocent child.
Yes, oh goodness. So you know what exactly when this, you have these signs and symptoms, it was very much of interest to find out exactly how this inflammation process is taking place in the body. And what I did was I noticed that this really takes place, this bacteria, via the membrane, attaches to the non-ciliated epithelium cells by a process called parasite endocytosis. A big word there. Also, the most important part that is thought to have caused this inflammation and process here is the LOS, which is the lipopolysaccharide, and that is on the membrane of the bacteria. And it's responsible, like I said, for most of the symptoms of gonorrhea and triggers the intense inflammation process. Because of this inflammation, a local immune IgA response takes place. And the inflammation focuses on the host defense and becomes the pathology of the disease. And the immunity is strain-specific, so reinfection can occur. Some of the signs and symptoms that you can have whenever you have gonorrhea, of course, there can be times when you don't have signs and symptoms. And women are most likely not to have the signs and symptoms. However, some of the symptoms they can have is burning and frequent urination, itching of their vaginal area, and foremost, a yellow vaginal discharge. And of course, like we said earlier, they can pass it on to their baby during the birthing process, and the child can have a yellowish drainage coming from the eye. However, the man who is most likely to have signs and symptoms of infection is a swelling and redness of his meatus, which is the opening of his penis. He also may have some some yellowish drainage coming from the penis area. Of course, when you find out you have gonorrhea, you want to be treated. So the most and foremost drug of treatment is Rocephin, and it's given IM intramuscular into your arm. However, the other drugs that you may take is Suprex and also Zithromax, and that is given orally 7 to 10 days. And the reason why you take that is because sometimes with gonorrhea it has a little buddy, co-infection of chlamydia. So, foremost, make sure you take all of your antibiotics, because if you don't, some of the complications can be endocarditis. You also, which is basically affecting the heart. You can have dermatitis arthritis syndrome. In addition to, you can become sterile if you do not take this medication.
In addition, isn't it some strains of gonorrhea are penicillin resistant?
Yes, because of the frequent use in the past of penicillin in the body has sometimes a resistance to this medication with certain bacteria.
Okay.
So I wonder, once we found out we got it and all that, what are some ways we can probably prevent this?
Well, prevention, I would say, you can use condoms, practice abstinence, and also a monogamous relationship with your partner can reduce that infection. Gonorrhea is diagnosed by clinical inspection, taking a sample of the cervix, the urethra, the eyes, and you can culture it on a modified Thayer plate, which has antibiotics and nutrients for it. And you would also have to use the oxidase reagent, which makes Neisseria gonorrhea positive. And you cannot get gonorrhea from sitting on or touching a toilet seat.
Oh, okay.
Nothing like that. And so it's always good to actually have a relationship where you can talk to your sexual partner and be honest to that person.
Okay, so with it all being said, I guess here's a little humor tip for you. If the faucet is leaking, call the plumber, because the toxic liquid can infect the cherry blossom. Thank you.